Hello guys, I'm Dr. Arshad Nadeem Awan with ultrasound and radiology teaching video. I do hope you will all be doing great. Today I'm going to discuss about the optic nerve glioma. Actually, optic nerve glioma is pilocytic astrocytoma, which is a very common in the children. It's a childhood tumor. It involves optic nerve, optic tract, optic chiasma, and it's always associated with NF1. So neurofibromatosis 1 would be the association with that. So for the clinical course is concerned, it happens to be very indolent, and on the MR is the best modality for that. On T1 weighted images, it will appear as an iso-intense or hypo-intense, while on T2 weighted images it will appear as an hyper-intense. So how we will appreciate all these on the MR images? Let's start looking for the optic nerve glioma, or in other words you may call it as an pilocytic astrocytoma. Optic nerve glioma, which is actually astrocytic tumor, and it is also called as pilocytic astrocytoma, and it's usually seen in childhood, and it involving the optic nerve, optic chiasma, and optic tract. Here very beautifully it is explained. You can appreciate towards the right side there is optic nerve glioma. You can appreciate that, and it is associated with the neurofibromatosis type 1. This is a MR image, T1 weighted image, and here you can appreciate it is a hypo intense. So this is what hypo intense look like on the MR images. This is optic nerve glioma. Another beautiful example of optic nerve glioma on MR image. This is T2 weighted image, and it appears to be hyperintense mass. So this hyperintense mass involving the optic nerve. So this is how the optic nerve glioma, or you can call it pilocytic astrocytoma, will appear on the MR images. Another example of the optic nerve glioma on the left side. Here it appears to be hypo-intense. This is the MR image. It is dilating the optic nerve, usually seen in the children. It is always associated with neurofibromatosis type 1. So the best modality to see that images are the MR, and on T1 weighted images it will appear as an iso-intense, which you are seen on that image. Another example of the optic nerve glioma on the T2 weighted images, because it appears hyper intense. Here on that image you can appreciate it is appearing as an hyper intense, and this is how the optic nerve glioma will appreciate on the MR images. Again, it's a CT image for the optic nerve glioma. It appears to be hyperdense. Here you can see hyperdense on the right side. So this involves the right side optic nerve. So this is optic nerve glioma. So you have seen multiple slides for the optic nerve glioma, and this is actually a pilocytic astrocytoma. Is a tumor of the childhood, and it's involving optic nerve, optic chiasma, and optic tract. It's associated with the neurofibromatosis type 1, and it would be hypo-intense on T1 weighted images and hyper-intense on T2 weighted images. On the CT, if you see that, it may appear as an hyperdense. So hope this would be a very beautiful video for you to understand and to recognize the optic nerve glioma. With some other informative video, we'll see each other. Till then, take great care of yourself, and thank you very much all guys.